we wanted to make sure that when we finally did get in the room with investors, that we weren't going in cold. You'd heard me pitch, you'd seen us on LinkedIn, you'd seen us won an award, you'd heard about us and you'd heard people talk about us. So we weren't going in cold. So it started with Innovator of the Year in 2018, Waiita, which was huge for us, a really big year. You know, the Lasan's Best Pitch of the West. We did the Start Cons, Pitch for $1 million. If there were a pitching opportunity, we were there, and we made sure we were there just so that we could start getting some noise and some recognition, because we are talking MedTech. We are in the most isolated city in the world. We are first-time female founders. So we really needed that exposure and that recognition.
Sup techies, it's time for yet another amazing round of Tech Society. Today we have Josephine Muir. Josephine is the CEO of Noisy Guts, a MedTech startup that is commercializing Australian research into an acoustic belt that listens to and analyzes gut noises to non-invasively diagnose and monitor gut disorders. She recently raised $1.5 million in capital, matched with $1 million in government funding, to finance the next stage of commercialization. Josephine's mission is to radically improve global gut health and promote gut health wellness.
Hello.
Hey, Josephine.
Oh, hey, Alex, how are you?
I'm good. How are you?
Yeah, it's going well, thank you. Yeah, can't complain.
How has Noisy Guts handled COVID-19? How has that affected your operations?
I think Noisy Guts has been really very fortunate. We closed our round on the 2nd of April, which was about 2 weeks after the real effects of COVID started hitting.
Wow.
So we just kind of snuck in before a lot of fallout. We noticed around us that a lot of other startups that thought they had funding secured, perhaps it started drying up as people were just, holding back, just seeing how the pandemic would play out. So I think we were very lucky to close when we did. And for us, we moved out of the office very quickly. We're based, as you know, at the QE2 Medical Centre, and we're in fact in the Centre for Infectious Diseases. So we were pretty keen to run home as fast as we could, and we're still here.
Yeah. So I take it they're actually doing COVID-19 research there?
Well, on our floor, it tends to be gonorrhea and meningococcal, but, even that's enough to be scary sometimes.
Stuff, yeah.
Yeah.
So tell us about the funding round. That's really exciting news.
It was really exciting news. We felt that we really couldn't celebrate at the time. We just felt that it was insensitive to so many other startups who were really struggling. And at that time, at the start of August, a lot of startups we knew in the ecosystem were really not quite ready to pivot, but were definitely panicking at that stage. So we just didn't feel it was something that we could go public with and celebrate, which was a bit of a shame because it is a huge milestone.
Yeah.
For a startup, any startup, but not something we felt like that we could publicly go and celebrate at the time.
I hope you do.
Yeah, I hope so too.
Well deserved.
Yeah, for sure.
I really want to talk about your fundraising experience, but first, can you just tell us a bit about Noisy Guts and how Noisy Guts got started?
Sure. So 5 years ago, my boss had a crazy brain fart. So he was sitting at the Innovator of the Year award and he was listening to an engineer talk about some acoustic sensing technology. And essentially it was little sensors, little microphones that you put in the foundations of a building, and it detects the tiny sounds of munching termites. So as he was sitting there, he started thinking about how else we could use this application. Could we apply it to gut noises? What if the gut has this secret language and we just need to be able to decode and translate those gut noises? So when he told me about this idea, most of his crazy ideas I let fly and just let it go through the keeper. But this is something that I felt very passionate about. I was really intrigued and curious about, well, what if we could understand gut noises? What if they are trying to tell us things? So it was something that was, I just felt really curious about. And knowing the struggle of people who suffer from chronic gut health disorders, something that I just felt that we could investigate. So we were very fortunate to attract some philanthropic funding from those very early stage, just to see if we could put a prototype together. And a prototype at this stage was something we made from bits from Bunnings and JCar and our favourite Austin computers. We started recording leg noises, heart noises, gut noises. We just started recording noises and listening to them. Anyone who walked past the office, we would like, hey, let's just put this sensor on your gut, and yeah, that sounds pretty cool. And then we noticed that my gut noises were quantitatively different from everyone else in the teams, and that's because I've got irritable bowel syndrome. IBS is a really common and chronic gut disorder, affecting 1 in 5 Australians. And it was almost, and that's what kind of got us started. So, oh, wow, isn't this an interesting finding? Yours sounds different to mine. And so then we started testing on patients. And that's how we came up with a non-invasive and accurate way of diagnosing common gut disorders such as irritable bowel syndrome.
So you were essentially the first case that clued noisy guts in that this was actually something that works.
Yeah, and what's funny is that I often talk to students thinking about STEM backgrounds, and they ask me about my role, and it's very glamorous when you as a CEO, but the really unglamorous part about it is that I record and analyse my gut noises 4 times a day. My team knows so much about my bowel movements. There is no dignity here. The belching, the bloating, the cramping, the noises, they are all over it. And we have a very lovely but quite shy Chinese machine learning expert. And I remember the first day she started, she was going through my diary, and she had kind of circled all of the words she didn't understand. And the first one was fart. And I thought, oh goodness, we're really going to get to know each other. So yeah, the team know everything about me.
All these industry specific terms.
Oh yeah. Which is just as well we don't, we're called noisy guts because the scientific term is borborygmi, and I'm still trying to work out how to spell it.
Yeah, I couldn't say it just after you said it, to be honest. It's actually something that's close to my heart because I'm actually a celiac. So I totally understand putting up with weird gut noises.
Yeah, indeed.
Fairly common. One of the questions I've always had is, what about pregnancy? Have you tested pregnant women to see if you can hear things going on in the placenta?
Yeah, interesting. No, we haven't because we don't have ethics clearance for that.
Oh, wow. Okay.
At the moment, we can't test on children, and it's kind of that 18 to 65-year-old adults.
Interesting.
Clinical trial that we have at the moment, which is expanding beyond IBS, but Crohn's, colitis, celiac, unfortunately is on hold because of COVID. So that's a little frustrating. And ultimately, one of the problems we were trying to solve at the time is that Professor Marshall, who was my boss at UWA, he had a patient who was a 9-year-old girl who we thought had irritable bowel syndrome, but we had no way of confirming and diagnosing that. And the only alternative was to do a colonoscopy. And that's why he was so motivated to find a non-invasive diagnostic test, because, are we really going to subject a 9-year-old child to a colonoscopy? It's
horrible.
It's uncomfortable. It's even the prep for people who have gut issues, just even the prep is really uncomfortable. So that's the problem we were trying to solve. But sadly, getting ethics to even for a non-invasive tool like ours, getting ethics to work with children is really difficult. So we started with the low-hanging fruit.
And IBS is, well, you already were a patient willing to
yeah, it's something that I know
yourself.
pretty well. It's been a long time, a post-infectious case of IBS that started in my 20s, so it's something I know really well. And I think one of the shifts we've made as a company over the past 12 months is really spending a lot more time with patients. We know that during COVID, a lot of our patients have had huge flare-ups. As a result of COVID-related stress and anxiety, because they're less mobile, they're not going out as much, perhaps their gym's closed, and they haven't made alternative arrangements, and that affects their motility. So we know that a lot of our patients have really struggled over this time. So it's been a really good. Over a couple of years, we've been really investor focused, and our website's been really investor focused. But we made a very deliberate decision to start building towards future customers, and really getting in touch with our patients and in touch with their their lived experience.
Just to go back to your previous boss, Professor Marshall, Professor Barry Marshall, right? Who's famous for giving himself an ulcer.
He is.
I do remember that, yeah.
Yeah.
Yeah, that's right. So this kind of experimentation is something that the whole team has embraced. And I remember, so I've been managing Prof's Research Centre at UWA for about 4 years. And it's funny how that type of it's not just a self-experimentation, but that out-of-box thinking is just something that happens so very naturally, and it's really infectious. And I think that's, sometimes when people hear the termite story, they say, but why did you, how could you have thought like that? For him, it's very natural, and it's just the way his brain thinks, very multidisciplinary and really, really creatively. It's one of the reasons I love him.
So what was the process like to be able to, because you said you closed funding recently, what were the steps leading up to that? And what was the process of finding someone who was willing to hear you out?
Look, we made a very deliberate decision to raise our profile and raise our brand. And that was, almost a 12-month period. So we started pitching, and we pitched everywhere.
And I've seen you pitch several times now,
and
you're right up there with the best I've seen. Absolutely, 100%.
The reason for that is because we wanted to make sure that when we finally did get in the room with investors, that we weren't going in cold. You'd heard me pitch, you'd seen us on LinkedIn, you'd seen us won an award, you'd heard about us, and you'd heard people talk about us. So we weren't going in cold. So it started with Innovator of the Year in 2018, Waiita, which was huge for us, a really big year. The Lasan's Best Pitch of the West, we did the Start Cons Pitch for $1 million. If there were a pitching opportunity, we were there, and we made sure we were there just so that we could start getting some noise and some recognition, because we are talking MedTech. We are in the most isolated city in the world. We are first-time female founders. So we really needed that exposure and that recognition. So that was a really deliberate step for us. But we recognised too that with this whole family and friend round, I don't know if you know my friends, and they're a great bunch, but they don't have $2.5 million lying around the place. So those people, huge shame. Yeah. But they weren't people in our immediate network. So we really had to start building bridges. And we started looking at, well, who else is getting funding and why are they getting funding? And as we kept pitching, particularly to VCs who we knew would never fund us, but they give you such a good grilling. They ask really great questions, and they pick holes in everything. So by the time we did get in the room with the investors that wrote checks, there was no question we hadn't heard. There was
Right.
no question we hadn't anticipated. We were ready and we were so confident that, I think that really helped in getting people over the line.
When you were finally in the room with someone that actually put pen to paper like that on a check, did you know? Like, did you smell it right away? Like, this person's different. These questions are slightly different.
Yeah, we did.
That's cool.
I would say there's kind of a hesitation because we did have a fence sitter. In fact, I think in Perth that kind of happens a bit. You have people who are interested and they're kind of looking, and then we scored one investor and then they all kind of came in. They all came in at exactly the same day, on exactly the same terms, and it was really neat. I mean, I did feel at the time it was like herding cats. But once, I do think, the questions do change. The questions become a lot more, like this is actually going to happen. And I think you do get a sense of that. In saying that, we were still disappointed that we thought we had people over the line, but, perhaps they didn't go the whole journey with us.
Did you focus most of your pitching efforts in Perth, or did you actually explore the rest of Australia overseas as well?
Interestingly, of our investors, most are actually from WA. There's only one international investor from the UK who's a very high-profile, well-known gut health guru, but most of our investors are local.
Wow, cool.
Which is kind of surprising, I guess.
Surprising,
but,
isn't it?
Yeah. I think they are here, and I think it's just about converting the high net worths that we have in WA and trying to get them interested in things other than bricks and mortar and in things that we dig out of the ground. So that's why I think the Perth Angel stuff is so important, just to try and I think maybe just some success stories. With OncoRes doing really well, with Orthocell, we're starting to see some success in Perth in that kind of MedTech pharma space, and that's kind of helping as well.
Do many of your investors have a medical background?
No.
Wow.
No. So this is very new for many of them.
Interesting.
Yeah.
Normally they like to invest in what they know best.
Things they know, yeah. That's always the struggle when you're in technology in general, let alone MedTech, which is an extra jump. And I'm sure you got a lot of hard questions about, approvals from the government and all the legal hurdles you must have had to jump through for MedTech. Can you tell us a bit about that?
Yeah, it's really interesting, but it's actually a bit of a red herring. So while sometimes the conversation can be about, how do you build a medical device under ISO 13485 guidelines, and how do you get through the TGA, and this FDA, it's going to be really hard. There are lots of companies that get through the TGA and FDA easily, but just because you have the right to sell a product doesn't actually mean that someone's going to buy it. So actually far more important than regulatory strategy is reimbursement. Who's going to pay for your device? And I think that's when you start talking about, this is just about making money and how do we make money? And we've got this product, so how much does it cost, and how much, what's the return, and who's going to pay for it, and how do we talk to health insurance companies about it? That's kind of a conversation that high net worths and angels are really happy to have because they understand how to make money. But I think as soon as you start talking about ISO frameworks or FDA and 510Ks, they just kind of, that sounds really, really scary. That bit's not the scary bit. There are so many other scary things about MedTech. Yeah, I don't think that's one.
When you talk about finding a market, did it help or hinder you that you potentially were the target market?
I think it's always helped because I understand what the frustrations are and where the bottlenecks are. I have to make sure that my perspective, I can't talk to every person out there who has IBS. There are lots of different subtypes, and my experience is very different from someone who has a different type of IBS. But it does allow me to go into IBS groups and feel really, really comfortable there and have conversations with people about IBS, IBD, Crohn's, colitis, people with celiac. And so we've put a lot of focus on customer discovery interviews. In fact, I don't think we've ever stopped doing them. We are always learning.
I guess when you're actually talking to someone else who suffers from IBS, that conversation is a lot easier to have, right?
Yeah.
So it's a lot less awkward when you understand.
Yeah, and I think it's helped in developing clinical protocols, and that's really helped as well, because I think there are conversations that you can have on a superficial level about IBS, and then there's the nitty-gritty stuff that we have to ask as well. So I think having that understanding is good.
Just to go back to the funding side of things, what about grants? Did Noisy Guts take advantage of state and federal grants?
Look, we have, and I think grant strapping is a really good option for many startups. I consider myself quite a grant writing queen, and certainly at UWA, this is one of the things that I'd spend most of my time doing. But even as a grant writing queen, my success rate is somewhere between 20 and 25%, which means that 3 out of 4 out of every grant I write ends in a Dear John letter. And we just got one last week for the innovation voucher. I mean, I'm bewildered. Why wouldn't the WA state government want to support us? But that just happens all the time.
That's always the frustrating side, though, isn't it? They don't actually, even when they send you that Dear John letter, the why of why you, not you, is not clear.
Yeah. So it's part art, it's part science, it's just a huge part frustration, because there's almost never, they very, very rarely get feedback. So it's just, you're throwing this out there, and then, and sometimes enormous wait times as well. So you'll be waiting for months. So one of the most frustrating things for us, and one of the things that was the impetus for us to jump out of UWA into the startup world, is that we had put our heart and soul into a clinical trial and cohort study grant. And it took months of work, and it was really, really good. There was a 5.74% success rate. So we were one of 95% of applicants that got rejected, and we were heartbroken because we really felt that we were going to do something really exciting with this grant. We thought it really fit the criteria. Very little feedback. And I think the NHMRC was deciding among lots of really good grants. All of the grants were of a really high value. So it's not that there's one good project and then all these other bad ones. They were all of a really high standard. But for reasons we'll never quite know, we were just not lucky. So, and it can be devastating to get that kind of rejection.
That's really hard. How did you maintain hope through this?
Work through those lows.
Yeah.
I think you just appreciate that, success will come. And, the next grant we did, which was the Biomedical Translation Bridge grant, and that's the one that we were successful for, and that's $1 million in matched funding from MTP Connect. And what's great about the BTB program is it's not just about the money, it's about their networks, they value add in terms of giving us advice and mentorship. They've been really great with helping me be more disciplined with risk. So there's mentoring opportunities as well. So the money is fantastic, but I love that it's more than just money with MTP Connect. Interesting
you talk about risk. As a CEO of a startup, where do you place yourself on the risk profile? Are you a risk taker? Are you a safe and steady? Probably not, but I want to hear it from you.
Yeah, probably not. I'm probably not on the safe and steady, but I have a co-founder who is the yin to my yang, and I have to say I love her. I couldn't do it without her. And I have a board that I have to be really disciplined with risk about. So it's interesting trying to balance, and we're at the moment we're at a really at a T-intersection making a decision about product developers moving forward. And a lot of it's around risk mitigation. Like, how do you choose between option A, B, C, D, and E? You know, lots of options, they're all really good. Yeah, and it's just about balancing that risk. And everyone has a slightly different risk appetite.
Yes.
And I guess, you know, that was an important thing to identify individually, because when we were deciding about taking the leap from UWA into a startup world, we really had to have some tough conversations, and a lot of those conversations were about risk and individuals' risk appetites. Can you give up your fortnightly salary to do this? Knowing that there are so many unknowns, knowing that we do not have funding, knowing that we may not get funding. We don't know how this is going to end. You know, you have to be a particular type of person to take that leap.
Absolutely. I totally agree. I wouldn't recommend anyone without an appetite for risk to get into startups. Not, in fact, just probably not even starting a business. Startup has a lot more risk than that even. Yeah, you need to have a healthy, maybe even less than healthy appetite for risk.
That's right.
Yeah, I think you do have to have a healthy appetite for it, but being disciplined with it as well, because I still have to report back to my board. I still have to justify the decisions I'm making.
There's a pun in there about just going with your gut.
Yeah, there is, isn't there?
As a pair of founders, have you required tiebreakers when you don't agree on the kind of risk you should take? Yeah, what's your experience with being like two people?
I think Mary and I have a really good yin and yang. We really do come from things from quite different perspectives. There's only been one issue that we've actually taken a disagreement on, and we just had to respect that we were going to disagree on that one issue. It wasn't a particularly important issue. I think what we've found during COVID is that having tough conversations on Zoom can be hard. Yes. And actually the time we've spent together in the room, talking about tough issues, whether they're, you know, really complex negotiations with multinational farmers or different strategy, it's so much easier for us to talk and to, you know, humour comes in and, you know, actually to get to an outcome when we're face to face and in the room together. So that's something we've certainly learned through this process. But I'm really lucky with Mary that she's really comfortable challenging my thinking. And this is what I'm thinking. What do you think? And, you know, she's certainly not backwards about coming forwards. And conversely, she allows me the privilege of me being able to really challenge her thinking on things as well. And we can do that pointedly, but without doing any harm.
That's brilliant and so important.
Yeah, I've met a number of solo founders, and I just think, wow, how do you do that? Yeah. I noticed particularly in the last 6 months, there are so many things that I've had to learn. It's such a vertical learning journey. How do you get to be an expert at everything? If I had to do this by myself, like, wow, there's a lot of science you've got to be over. There's a lot of engineering. There's a lot of tech stuff. But, you know, who does R&D and ESIC forms and can do payroll as well as, you know, write blogs on Instagram? Like, it's just so much. I'm so pleased that Mary and I can kind of conquer and divide, and you do this bit and I'll do this bit, and because
you find that each of you have different strengths and interests that makes you gravitate towards things that you like the most.
Yeah.
I mean, Mary's background in clinical trials kind of naturally makes her a great chief scientific officer. So that's where she naturally fits. But as a co-founder, she certainly loves to be over the finances, and she likes to take a look at risk. And but I think sometimes it's nice to be able to say, well, you know, I'll do this bit, and hey, you do that bit, and that's kind of nice. There's certainly things I like to outsource to her and think, oh, thank goodness she's over this, and I can just come in and do the do high level strategy stuff. But it's just really nice to be able to share and share the journey with someone as well.
Well, we've talked to a lot of, what you classify as business experts, business shamans, and I think the most consistent piece of advice we've gotten is you can't do it alone, and you can't be on top of everything, because there are things that are required that if you're good at one thing, it's very unlikely you're going to be good at that other thing. So someone who's good at getting in front of crowds and providing charisma to a company is probably not going to want to sit in front of the books.
But when there's like a skill that might be missing in the group, so fundraising is a good example where neither of you are might not have been experienced in getting investment right from the beginning. Did you look into perhaps, I don't know, finding a mentor to help you through this process, or did you just kind of go through it on your own and just try to learn as you go along?
Actually, that's a really good question. How did you get started? Yeah,
that's right.
Yeah, and the fundraising is a funny one, because there are people out there who are very willing to do it for you. Give me a monthly retainer and 8%, and I'll do it for you. We really decided against that, and I think part of that was around being a bit of a control freak and not wanting to let go. But the other part of it was an acknowledgement that people aren't, in fact, investing in our tech. They're investing in Mary and myself. So we have to be in the room, because you're investing in us and in our ability to take this tech forward. And so it didn't make sense to us to outsource the fundraising to someone else. In terms of the mentoring, we have been so blessed. We did a number of accelerator programs, and we met through the Curtin Ignition program. I met Cheryl Frame.
Cool.
Cheryl's been amazing. And through CSIRO, we met Greg Reeby, and Greg has continuously and, just week after week just shows up. We just love him to bits, and he really has gone, beyond, we finished with CSIROs on programs in 2018, and he's still turning up 2 years later. So he's really taken on that role and just keeps turning up, and we just love him for it. And we couldn't do it without his mentorship and his guidance. There have been, there were really tough things that we had no experience in. And one of them was, we started working with a really big multinational healthcare organisation and we spent about 6 months thinking that they would be almost our sole investor. And that was a really complicated process and lots of time. And the more time you invest, the more time they invest. You think, oh, we're nearly there. Only to find just before Christmas that we decided it was just never going to work. Wow. And that was really tough, because I really saw a future with them. And I think they really saw a future with us. And Greg was the person who just kind of volunteered of, I can hop on a plane and I can come to that meeting with you. And we were so grateful for his wisdom. And even when we just need to talk it out, with someone. This is how, this is what we're thinking. How does this sound? Just an excellent sounding board.
Wow. So was he the one who spotted that it wasn't working, or he just helped you through that conversation to come to that conclusion?
I think the skill of a good mentor is that they just keep asking really good questions, and they ask the tough questions, and the tough questions that perhaps we didn't quite have answers for. And that's what Greg does for us. And throughout that process, he just kept on asking tough questions. And when you hear those questions reflected back, that's when you start seeing the problems. Right. Yeah. Sometimes it's just hearing it come back at you. You think, oof, that's a biggie.
That's been our experience with Greg Reeby. He's he can spot the weak spots. Yeah. But not point them out, just get you to
ask
see
you
them.
a question till you
ask you the questions and see if you can see them. Yeah. But I think one of the greatest resources, and I've perhaps more aware of this during COVID, because we're not networking and we're not going to events and we're not catching up as we did.
Yeah.
It's been a good opportunity to contact people via LinkedIn, other startup founders about their experiences. I found perhaps people are more open to those cold calls. Perhaps they wouldn't normally, take that call, but, hey, I'm home, I'm on Zoom. Yeah, I'm happy to talk to you. And I've really found them to be incredibly generous with their time and expertise. And for me, having someone who's taken a product to market already, so, just a few steps ahead of us, that's the best resource. And I'm really thankful for those in the ecosystem who are so generous with their time and their stories.
What kind of struggles have you had on the hardware side?
Hardware costs more than you think. Yeah, we've learnt that one. I think our challenge is that we have two products. One is a diagnostic test and one is a monitoring product. And with the diagnostic test, no one expects the diagnostic test to be beautiful. The acoustic belt doesn't have to be beautiful. It's a diagnosis. As long as it's accurate and it works every time, that's what people care about. But the same hardware we're using for a monitoring device, something that people can use at home to monitor, track their symptoms, identify what's triggering their flare-ups and what are those triggers for them. And this is something that does have to be beautiful. People have to feel comfortable wearing it. You have to put it on and put it off. And I think because we're trying to do both of those things, have something that people don't care what it looks like, plus, another user case where, the usability of it is really key. I think that's been the challenge for us.
In what way, if you don't mind me asking?
Just trying to balance those two user cases because they're quite different.
Yeah.
Yeah.
So was it ever a temptation to unify the hardware? Or
We've gone with that option, but then kind of, everything comes down to budget, doesn't it? So
of course, yeah. Is that different now that you've gotten more funding? Is the temptation?
Because what you learn is that those quotes that people gave you when this was kind of a hypothetical, once it becomes a reality of, okay, I actually want to take this prototype through to a pilot device and onto market, all of a sudden the quotes double. That's really interesting.
With the manufacturing, are you manufacturing in China? Have you spoken to Australian manufacturers? What's your experience been there? It's a big focus at the moment because of COVID-19. Like our experience has been, we really wanted to get it manufactured here, our product, and that just turned out to not be possible, to be honest.
Yeah, look, it certainly doesn't look like it's possible in WA. We don't have a ISO 13485 manufacturer here. We do have a number of options in Sydney, and so that is an option for us. But, I was talking to a MedTech founder the other day who said that it was easier for her to manufacture in Singapore because it's easier being in the same time zone that you can go up to Singapore back in a day rather than go to the East Coast, which actually, business takes longer. So I found that really extraordinary. But I think there's a lot that we don't know about the manufacturing stage yet. But I do think it's one that you'd really want to keep your finger very, very closely on the pulse about, to be able to look and feel and touch and make sure that product, those injection molds are exactly the way you want them, because a run is going to be so expensive.
That's right.
So not having those facilities in WA, I think, is a huge shame.
It is, absolutely. I'm hoping that changes because of COVID-19.
I hope so. For us, the other missing link, so if we're looking at a value chain, we would also need industrial designers who are ISO accredited, along with software, medical software, digital health with that ISO accreditation, and the manufacturing. So it's not just that we need to put one piece in the jigsaw puzzle. They're actually, for us, we would need 2 or 3 pieces to be here for us to do all of our product development from Perth.
That kind of local talent must be very hard to find.
Yeah, and it's
not a focus of our industry at all to build that kind of stuff or design it as well.
Yeah, And we're actually interviewing for a machine learning person at the moment. And it's so upsetting that we just can't take on an international candidate at the moment, because we just don't know how we're going to get them here. We don't know when the borders will open. We do have a lot of data scientists in WA listening to things come out of the ground. So we're just trying to see if we can snaffle someone from mining who's interested in gut noises.
It's the downside is they're probably earning gigantic amounts of money.
Thanks, Alex.
I just mean
CEOs are doing well. I can confirm.
It's a problem we run into consistently. That if you're in that industry, you are making far above market rate.
Yeah, of course. Of course.
And while they may not love their job because it's not that interesting, it's hard to compete with big mining bucks.
Yeah, of course.
But there's definitely a lot of machine learning talent in Perth. We can probably help you with that, actually.
Excellent. Actually, we have found we've got a really good number of applicants, and we're interviewing at the moment. So we've been really impressed with the local talent, and particularly it seems that the Perth Machine Learning Group has been really active, and they've certainly sent us a number of candidates. So that's been really great to get them involved. As well as the Computer Society, the ACS, they've been really active and seem to have, perhaps not during COVID, but pre-COVID, they had a good number of people turning up to monthly meetings. So it's good to see.
What about UWA? Have you spoken to anyone from UWA? I know there's a lot of data science groups and students there.
Yeah, we have one working for us at the moment. So they've been a really good source of young talent.
You brought up investors, you brought up grants, but have you actually looked into the crowdfunding approach, Kickstarter, Indiegogo, kind of ways of pulling and getting money from people that actually want your product?
Yeah, we did. We did look at it. I guess the question for us is, how close to market do you need to be to get money from people? Will people wait 3 months? Will people wait 6 months?
They want it yesterday.
Our experience is they want it right away.
Yeah. So we've got a 2-year. At the time when we were fundraising, we had a 2-year runway to market. Are people going to wait 2 years? Give us money now, and hey, we'll be back to you soon-ish. So it really wasn't an option for us. What we did try that worked in terms of the crowdsourcing is a great way for us to get patient recruits. So when we're trying to find people with IBS, Crohn's, colitis, and even, we've had 300 people wear the belt so far. It's a really good way of getting the word out and getting people knowing about the project. This is the type of person or type of guts we're looking for.
Are you still looking for people? Can we put the call to action out, or do you have enough now?
No, we're always looking for people. We've got ethics now to have people in their homes recording their gut noises for us. So, on your Paul, he's doing some gut recordings for me now. So yeah, that's we're always looking for volunteers with particularly with IBS, so that we can look for different symptoms and get different, build our data set.
So where do they go if they would like to be a part of this?
They can just contact us through our website, which is noisyguts.net.
Yep. And
they'll find us pretty easily.
And what does that entail for them? Do they actually get one of these devices in the mail, or they visit you and they?
No, one of our team drops the belt off, shows you how to use it. Unfortunately, as part of our ethics, we can't give people any feedback or data about what we're finding, but they record their gut noises. Often we ask for 2 recordings a day, so one before they've eaten in the mornings, and then throughout the day. What we find is that with people working from home, often at their desk, that once you have the belt on, as I do, often throughout the day, as long as I'm not talking, so I turn it off for phone calls, but it stays on, and I can actually do 3, 4, 5 recordings in a day without it being terribly intrusive. Yeah, so it's pretty easy to do, and we ask people to take notes about any symptoms they're having at the time. Yeah, but it's pretty easy to do, and certainly helps in terms of building our data set.
I love it. I love how it looks, actually. In the night, I mean this nicely. It's kind of like Mad Max-esque.
Excellent. Well, this is good. We kind of feel that it's that Lara Croft. One of the part of our images is that she has her fists, clenched, in the picture of the belt. And part of that is around just empowering people with chronic gut health issues. The patients we talk to are often really disempowered. They've been stuffed around by the medical system. No one believes them. They're sick of feeling sick. They're just, they're sick and tired of feeling fatigued all of the time. So giving them information that is scientifically robust and validated. And I think that's one of the things we've learned about our customers is that they've been sold snake oil on Facebook. This is the cure. And God love it, always looking, because they're in pain and because they're having symptoms, they're always keen to put their hand in their wallet, but often they'll buy stuff that's just rubbish. And they feel really, frustrated and sometimes really shamed by falling for something. And then, when you ask them, what kind of clinical data does this product have? Did you look at the ingredients, or who's behind this? Is there a scientist at all? And they're kind of ashamed that they kind of fell for what was really good marketing.
Especially sufferers of Crohn's, can be really debilitating. Absolutely,
and particularly when there's such a high occurrence of relapses, sometimes annually. That's a huge imposition.
And actually figuring out foods that can irritate you and cause you problems is often quite difficult.
Yes,
and not the same for everyone, obviously.
Yeah, so this is about day 280 on the low FODMAP diet. So I try lots of different diets and interventions. Recently went through peppermint oil. Wouldn't recommend that one. But yeah, so no lactose, no fructose, no onion, garlic, oligosaccharides.
No onion.
Garlic. Yeah, no, that's the worst one. Onion and garlic. I really miss that. And then we try different. The team are always coming up with different experiments for me to try, and then we just record with the belt to see what impact it has. Yeah, nothing like some action research.
Any plans to release an audio book?
I did. So one of the things we did celebrate during COVID, and this was right in the middle of COVID, is we had our 1 year anniversary of spinning out of UWA, and registering as a company. I thought, we can't let this go without a party. We've let other things go, but surely this is something we can celebrate. So I got all of the different gut noises and put it to the tune of Happy Birthday, and I sent that out on little thumb drives to our team. And it was, of course, it's pretty gross when you're listening to my gut noises, but
That's fantastic.
got to get your laugh somehow.
I was actually going to. We always end in these interviews with a fun question. I was going to ask you what's the most whimsical thing to come out of the device, out of the recordings, and I think you actually just answered that question.
Well, even today, we just got an email from someone in the UK to Prof Marshall asking for recordings, gut noise recordings, because he would like to do a composition based on digestive noises. And I thought, that could be interesting. Maybe there's an opera or a concerto just waiting. Maybe my stomach is going to be famous.
That'd be awesome.
It'd be really, really good. What was the response?
Mary kind of sent it to me with a WTF kind of response, but I think it could be fun.
Let's roll with it. With it. Yeah.
Well, we might need a new theme track, or
theme song. That'd be cool.
Yeah, new theme song.
I look forward to it.
It could be like your, you know how wrestlers have an intro song as they're heading towards the ring. Like that can be your
Gut noises.
Yeah,
Gut noises. I can just see next time I pitch, you know, other people have Rocky going on, and I've just got, you know, gut noises. Yeah.
All right. Well, I guess we won't take up too much more of your time. I think the question I really want to ask you, and that a lot of people will be interested, is what's your advice to people who are just about to make the same journey you've been on, and they're at that precipice, you know, just about to chase the idea, chase this, you know, begin a startup? What's if there's advice that you could have received that would meant you skipped, let's say, 6 months of pain, what would it be?
Look, I heard Matthew Pavlich talk yesterday about being comfortable with being uncomfortable, and I think everyone has their own strategies for how do you get comfortable when you're really uncomfortable. And I notice with the startup founders that I'm talking to that you spend a lot of time outside your comfort zone doing stuff you've never done before. So I guess I would be really loath to give myself advice that from 4 years ago, because I would say keep those rose-colored glasses on, keep that optimism, keep that, can-do attitude, because if you knew how hard, and sometimes it does get really hard, if you knew how hard it was going to be, you might, if you're on the precipice and you were just deciding about whether or not to jump, you might kind of go, oh God, maybe there are easier ways to make money. So I don't know if I would go backwards and think, I don't know if I'd want my rose-coloured glasses changed. But what I do say to startup founders is, how do you eat an elephant? Well, you eat it one bite at a time. It can be overwhelming. Yeah. And I'm the type of person, I want to know how big the elephant is. I want to know what size it is, how hairy it is. I need to know the general. But after that, it's like, I'm good. I don't need to see that again. I'm just going to start with the leg. And I'll just do one little bit at a time. And I think the more time you spend in the saddle, you do get comfortable.
Do the job that's in front of you.
Just do the job that's in front of you.
Yeah.
And tomorrow there's going to be another job to do. You do that.
And ignorance is bliss. It was the message.
I really reckon it is.
Yeah.
Just keep those. I just think you need a lot of optimism in this game. As well as a lot of stubbornness. And thankfully I've been blessed with that, as I'm sure my family can attest to. But I think you need a lot of optimism in this game. Because sometimes things don't work out, and we get that with our tech all the time as well. We think that this is a really good way of solving problems with our data. Whoops, no, it doesn't work. Going to have to try something else. There's so much of that in the startup space. Of you try something, doesn't work, that's all right. Just try something else.
Keep moving.
You've got to have a lot of optimism to keep doing that.
All right, we'll end on a really boring question. What is your elevator pitch?
What's my elevator pitch? Well, I normally try and throw in lots of puns about gut noises.
Nice.
But thankfully, I do remember when Prof started talking about borborygmus, like he lost me, halfway into his speech, he lost me because I really didn't understand a lot about the inner workings of the gut. So I'd really tried to work out how could I communicate this to someone in a way that they would give me money after about 30 seconds, because that's
that's the elevator pitch.
That's how much I've got time for. So thankfully that's where Noisy Guts came from. And normally when I tell people, hi, I'm Josephine, I'm from Noisy Guts, that kind of does some of my work for me. But so my elevator pitch is really to just talk about guts and ask people, have you ever wondered what your gut's trying to tell you? And often if it's 6 o'clock and getting towards dinner time, it's a question that people think, oh yeah, actually I'm kind of feeling hungry and I'm kind of got some gut noises happening right now. So it's often been a really good conversation starter. And I think that's what you want for your elevator pitch, not for you to say as much as you can about your startup in 30 seconds. But what you really want to achieve is someone who's willing to go, oh, that sounds really cool. Let's have a conversation about that. So what I try and say to other startup founders is say less, listen more, and see if you can just ask a question. Have you ever wondered what your rumbling gut's trying to tell you? And maybe that's enough.
That's brilliant. And I think it's the first time I've ever heard that advice. Elevator pitches are usually like, try to distill your idea into 10 seconds.
That's right.
Yeah.
Yeah.
But every pitch is just an opportunity to score the next pitch.
Yeah,
of course.
You know, that next meeting, that next opportunity. So that's all you're trying to achieve.
And spread awareness that you exist.
Yeah. And I know that's, I know as the Waita people are pitching this week and up for the next round of judging, that's the advice I've been giving people, try not to cram everything, everything about your business into a 15-minute pitch, or if you've got 5 minutes for your pitch, or whatever the time frame is, try and leave some room and some space there for asking questions, and so you're listening more, you're learning. Yeah.
That was really good. Thank you for that.
Excellent.
Yeah, thanks for your time, Joe.
Yeah.
Pleasure.
Really appreciate it.
Great. Okay. Thanks so much.
Right. Thank you.
All right. Bye.
See ya.
That concludes this episode of Tech Society. It was great to have Josephine come onto the show, and we hope you've come away with some useful knowledge on the funding journey for startups. As always, come check us out at techsociety.fm or tweet us at techsociety if you have any comments you'd like to share. Ninja Software sponsors this episode, whom you can check out over at ninjas.dev.